Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be going over somatic symptom disorder. This is going to be a short video because you know how I do. I get straight to the point. Before we get started, as always, I'm going to ask you, please support me, support this channel by liking this video, subscribing to this channel if you haven't done so already, and press that red notification bell so you'll be notified every single time a new video has been released. Don't forget, I'm now offering next generation NCLEX reviews and one-on-one consultations, sessions, tutoring. If there's something you want to talk to me about or ask me advice about, I am there. Also, audio lessons. I have all of this you can book or you can get from my website, nexusnursinginstitute.com. All right, so let's get started. Somatization. Let me make this a little bit larger so you can see. All right. So somatization, that's the expression of stress through physical symptoms. So what's happening with this type of patient is there's something psychologically going on. So they're anxious about something, they're nervous about something, they're frustrated about something, but it's manifesting in a physical form. So that client who has something coming up, like a big review coming up, and now they have a headache, or they have a stomach ache, right? But the real problem is that frustration or maybe an anger or maybe an anxiety that they have, but it's manifesting physically. That's what's happening. Look what it says right here. It says, instead of feeling anxiety, depression, or irritability, some individuals experience pain, paralysis, unexplained skin rashes, and or other symptoms. So again, guys, it's the problem, something's going on with them psychologically, but it's manifesting physiologically. Okay. So what is your job in this situation? You're going to utilize a holistic approach. Your nursing interventions is going to be for the entire patient, not only the physical ailment, because remember, the underlying cause is what? Psychological. So it says this approach emphasizes the multidimensional interplay of biological, psychological, and sociocultural needs and its effect on this somatization process. Now let's take a look, clinical picture, what this patient's going to look like. The somatic symptom disorder, it's characterized by a focus on somatic, that's the physical symptoms, such as pain, fatigue, look at this, guys, to the point of excessive concern, preoccupation, and fear. They are so preoccupied and concerned with this physical ailment, but remember that physical ailment is just a manifestation of what? The psychological. Look up here. Let's take a look at this DSM-5. So the criteria for a patient to be diagnosed with somatic symptom disorder. I'm not going to go over all of them. I put a star and I underlined or highlighted the ones that you're likely to see for testing purposes, but feel free to read all of it on your own because I don't write your exams. I don't know what's going to be on there. All right, but take a look at B, excessive thoughts, feelings, behaviors related to somatic symptoms or associated with health concerns as manifested by at least one of the following. And here's the choice that you have out of three. They have to have at least one of those. One, a disproportionate and persistent, that means it's not going away, persistent thoughts about seriousness of one's symptoms. Two, a persistently high level of anxiety about the health or symptoms. And three, excessive time and energy has been devoted to these symptoms or health concerns. These symptoms to the patient is real, and they have a preoccupation with the symptoms that they have. Look at C. Although any one somatic symptom may not be continuously present, the state of being symptomatic is persistent. So they have to have it persistently. They have to have it for more than 6 months. When you see that word persistent, that means despite evidence-based practice measures that have been applied, it's not going away. That's what it means when you see that word persistent. Look what it says here. Let me move this up a little bit for you. It says, in somatic symptom disorder, there tends to be a high level of help seeking, which rarely alleviates the patient's concerns. Well, guess why it's not relieving the patient's concerns? Because those physical symptoms that they're feeling, remember, the underlying cause is psychological. Among common symptoms for primary care visits are chest pain, fatigue, dizziness, headache, swelling, back pain, shortness of breath, insomnia, abdominal pain, numbness. Those are signs and symptoms. Those are the common complaints that the patient will come in with. Let's look at what it says. It says patients see their bodily symptoms as unduly threatening. They are very afraid. They're very afraid for their health. They're very afraid for their life. Again, these symptoms are real to them, okay? So they see them as unduly, and notice they could have just wrote threatening, but it's unduly threatening. That means you as a nurse, the healthcare providers, we know that like this isn't going to kill the patient, but in the patient's mind, it is going to kill them. It is going to harden them. That's why you see that word unduly. Whenever you're studying and you see an adjective thrown in front of a verb or a noun, you have to say to yourself, okay, well, why did they put this word in here? Because they could have left that word out and it still would have been a complete sentence, okay? There's a reason they put unduly, unnecessarily, right? Unduly threatening, harmful, troublesome, often fearing the worst about their health. Let's go. I'm going to skip some pages because there's something else I want to talk to you about. Look at the assessment guidelines for somatic disorders. 1, you want to assess nature, location, onset characteristics, and duration of symptoms. Just because a patient has somatic symptom disorder and they have a complaint, guess what? You cannot ignore that complaint and just say, oh, that's part of their disease process. Because remember, for example, that chest pain is one of the common complaints that they have. Well, guess what? What if that patient that is diagnosed with somatic symptom disorder is having an MI? So always, with every complaint, you always have to assess the patient. And we're going to talk about this a little bit, but after you've completely assessed the patient and you've ruled out, the healthcare provider has ruled out any, harmful or anything lethal to the patient, you're not going to keep assessing them, because what you're doing is reinforcing those false thoughts that they're having about their health. Okay? So what am I saying to you? At the initial complaint, you're going to assess your patient, but once it's been found that nothing is wrong with that patient, you're not going to keep like doing vitals and keep doing all these unnecessary assessments, because all you're going to do is reinforce the thoughts that the patient has. But the first thing you always want to do, Maslow's hierarchy of needs, guys, your priority is physiological integrity. You want to make sure there is nothing that is risking that patient's physiological integrity. So important things such as vital signs, airway, breathing, circulation, hemodynamic status, glucose, nutrition, all that good stuff that keeps the patient alive, you want to make sure that they're stable. Look at number 3. It says identify symptoms of anxiety, depression, past trauma that may be contributing to somatic symptoms and ability to meet the basic physical and safety security needs. Why? Because their physical safety security needs is number 1. And what we find with the patients that have some somatic symptom disorder, many of them have been abused physically or sexually in their childhood, and stress is a trigger. So you want to, after you've done your physical assessment and you've found nothing wrong with them physically, that's when you move on to the psychological. That's when you move on to the underlying cause. Take a look at number 5. Identify any secondary gain that the patient's experiencing from symptoms. What is secondary gains? Those are things that make the patient happy. How can I explain it? Those are things that the patient gets that makes them happy from their ailment. So for example, they're complaining of a headache. Now you're assessing them. You're giving them attention. You're spending time with them. Those are secondary gains. They're getting this attention. They're getting this extra time from the complaint that they had. Those are secondary gains. So you have to be very careful as a nurse not to reinforce secondary gains, because there will be no incentive for the patient to actually confront their frustration or their anger or their anxiety, because every time they complain of a physical problem, you make them feel better. You sit with them, you talk to them, you give them the attention. Those are secondary gains that the patient has. So you have to be careful about that. I keep saying choice, but number 8, screen for misuse of prescribed medication and substance use. Make sure that patient isn't self-medicating themselves, taking opioids or alcohol or something else that hasn't been prescribed to them for the physical ailments that they're describing that they feel. Again, guys, I'm only going over the ones that show up on tests the most, but I don't write your exam. So please pause and make sure you read the entire assessment guideline. Look at this box: signs and symptoms, nursing diagnoses, and outcomes for somatic symptoms. Now, I encourage you guys to go through the entire box, but I want to focus on the outcomes. What are our outcomes? For the patient to be able to identify ineffective coping patterns. If they were able to cope with their stress or their anxiety or their frustration, guess what? They wouldn't be having these physical symptoms that they need attention paid to, right? So one of your jobs as a nurse is to help them identify coping strategies and patterns, and you have to help them identify when they start to feel frustrated, when they start to feel anxious, right? That's the first step. They have to even know when they're starting to have these feelings. They have to be able to identify it and learn how to cope with it. Is it by going for a walk? Is it by reading a book? Is it by reaching out to one of their support systems, someone who loves them and will encourage them? But they have to be able to identify that feeling and how to cope with it. Recognizing associated symptoms of pain. Look what it says: reports of pain control, identify support system. This is important. You have to help that patient to identify who do they have in their life that they can trust, that can support them. If they start to feel anxious or nervous or angry or whatever it is that's going on with them, that they can reach out and have someone to talk to, because that will help decrease these somatic symptoms that the patient has. Because guys, these somatic symptoms, these physical symptoms, that's just the physical outlet for a psychological underlying cause. Okay. What else? Look, verbalizing positive regard for self. Them being able to describe themselves as successful, strong. That's very important. That's going to that provides positive feedback for the patient, and it decreases low self-esteem that the patient may have. I think there was one more thing I wanted to go over with you. Yes, take a look. Look at this box. I'm not going to go over all of them, but I encourage you to. I don't write your test, but I'm going to go over some of them with you. Important nursing interventions for patients with somatic symptom disorders. After physical complaints have been investigated, notice it said after. Always. The first thing you're always going to do is assess your patient physiologically, right? So after the physical complaints have been investigated, avoid further reinforcement. How do you do that? Stop taking vital signs each time they have a complaint. You've already assessed them, okay? Look at this. Look at what's next. Spend time with the patient, but let's keep going, at times other than when the patient summons the nurse to voice physical complaints. Why? Because if the only time you're spending time with the patient, every time they have a complaint, that's when you want to have a therapeutic communication. That's when you want to sit next to them. That's when you want to spend time with them. What's the point of trying to get better? Because you're reinforcing that behavior. So you need to be spending time with them outside of the time when they have complaints. Do not imply that the symptoms are not real. Why? Because they are real to the patient. Okay. So you have to let the patient know that you understand that the symptoms they're feeling is real to them. You want to shift focus from the somatic complaints to their feelings or their thoughts, because remember, the underlying cause is psychological. Avoid fostering dependency needs. You want to show respect for the patient's feelings while minimizing secondary gains. Remember, secondary gains is what they get from those complaints, such as you sitting down with them, you spending time with them every single time they have a complaint. You want to teach them assertive communication. Provides patient with a positive means of getting their needs met. Teach them how to reach out to one of the support systems that you help them identify. Teach the patient stress reduction techniques, such as meditation, relaxation, mild physical exercise, such as going for a walk. Why? These are important coping strategies. And the more that they learn how to cope with those intense feelings that they try to avoid, the less somatic symptoms that the patient's going to have. Okay. Let me double check and just make sure that was the last box I wanted to cover with you. And I lied, it was not the last box. This is the last one. Okay, so goals for this patient. We want to help them identify levels of anxiety. As soon as their anxiety starts to rise, we want them to be able to identify it, right? Because once they identify it, they can start using their coping strategies. Um, we want them, the patient will seek support from staff and patients when feelings of anxiety become difficult to handle or physical symptoms increase. We're going to educate the patient about sharing their feelings. Patient will make a list of contacts. Remember, I told you those contacts are going to be very important for effective coping. Patient will utilize the therapeutic milieu to increase her ability or his ability to express feelings. Why? We want them to express their feelings, their thoughts. Why? That's going to decrease those somatic complaints that the patient has. And guys, that is somatic symptom syndrome or disorder in a nutshell. Please let me know what you guys thought about this video. Let me know if you'd like to see a series, because there are different types of disorders in this cluster. So I definitely will have no problem doing that. Let me know what you'd like to see me cover. Don't forget, I'm tutoring one-on-one now. I'm doing NCLEX, next generation NCLEX reviews. I still have my audio lessons available. All of that you can book or get on my website, nexusnursinginstitute.com. Guys, thank you so much for watching. And you guys will catch me on the next video.